Let me ask you this, in a sense, philosophical question. We've gone a little bit into philosophy today. I believe, many people in my own state believe, that healthcare is a right, R-I-G-H-T, regardless of income, that every American has the right to the best quality healthcare that the system can offer regardless of income, that if you're a low-income kid, you're a wealthy kid, you have the same opportunity to access the healthcare system. Do you believe that?
I believe that every person ought to get good health care, and the Hippocratic Oath says that I would provide health care regardless of whether the person pays me or not. So I definitely believe that people need health care.
Give the mic over to Senator Paul.
Thank you very much. With regard to the idea of whether or not you have a right to a health care, you have to realize what that implies. It's not an abstraction. I'm a physician. That means you have a right to come to my house and conscript me. It means you believe in slavery. It means that you're going to enslave not only me, but the janitor at my hospital, the person who cleans my office, the assistants who work in my office, the nurses. If you have a right to their services, basically, once you imply a belief in a right to someone's services, do you have a right to plumbing? Do you have a right to water? Do you have a right to food? You're basically saying that you believe in slavery. You're saying you believe in taking and extracting from another person. Our founding documents were very clear about this. You have a right to pursue happiness, but there's no guarantee of physical comfort. There's no guarantee of concrete items. In order to give something concrete or someone service, you got to take it from someone. So there's an implied threat of force. If I'm a physician in your community and you say you have a right to health care, do you have a right to beat down my door with the police, escort me away, and force me to take care of you? That's ultimately what the right to free health care would be. If you believe in a right to health care, you're believing in basically the use of force to conscript someone to do your bidding.